All right. Let's talk about what you need to know for the INBDE exam. Hello, everyone. Welcome again to another episode of the MDI Prep INBDE podcast, where we share actual topics that have appeared on the exam. As always, remember that these brief podcasts are just to introduce you to what appears on the exam, and it's not intended to replace actual study programs. So if you want an actual program, a live online class, be sure to visit our website at www.mdiprep.online, or you can give us a call at 1-888-827-9881. Remember, all of our live online classes come with everything you need to prepare for the exam, including all of the resources. Well, without any further ado, we're going to jump right into it today. We're going to be talking to Dr. Marion today about radiology and the type of questions that you might see related to radiology on the exam. So everyone, let's welcome Dr. Marion to the group.
Hi, Dr. Sen. It's nice to be here again.
Good. How have you been?
It's been good.
Good. I heard you got an interview coming up.
Yeah, I'm pretty nervous about it.
Don't be nervous. Now, why are you nervous?
Well, it's going to be my first interview,
Okay.
so in the cycle. So, yeah, it is. It's going to be quite an experience.
Yeah. But you know what the cool part about this is that it's your first interview. And how many interviews do you need to get into a dental program? One.
Yeah.
Exactly. Right. You just need one person to say yes, right?
Yeah, absolutely.
There we go. That's right. And so it all started with you, first of all, passing the INBDE exam.
Yeah.
So you couldn't even get an interview if you hadn't passed that exam.
Yeah, it was a big exam to pass.
Yes. So today you're going to be sharing with us what?
I'm going to share the question that came up on my exam about radiology.
Okay. All right. Perfect. All right.
I just divided it into three parts. Like when they ask about radiology, they usually ask about collimation, filtration, the X-ray machine itself.
Okay.
Or any kind of disease that's appear on the X-ray.
Okay.
So relation between the X-ray and the disease that you can tell from the X-ray.
Okay.
And the last thing is certain landmarks.
Oh,
That
okay.
you usually see on the X-ray, panoramic X-ray or cephalometric or periapical. And actually, I had like 2 questions or 3 questions like that. And once you know it, it's so easy to recognize it.
So when you talk about landmarks on the X-ray, how much gross anatomy is required to understand those landmarks, or is it more so just understanding the radiograph itself, or do you have to really know the gross anatomy?
Yes, part of it, yeah.
Okay.
You do have to know the gross anatomy.
Okay.
And you have to differentiate between the nerve and the soft tissue and the tongue and the pathway, because they can trick you in these areas. So now today you're going to be sharing with us how to identify those things on the radiograph? Yeah.
Okay.
Yeah. So one of the questions, actually that question, it came up twice.
Okay.
To identify hyoid bone.
Oh, the hyoid bone.
Yeah.
Okay, perfect.
And I'm telling everyone, it's so easy to recognize it once you've seen it before.
Okay.
And they can't do much about it. Like if they have a cephalometric X-ray, so you know where the hyoid bone will be located.
Okay.
Or panoramic X-ray, you know where the hyoid bone will be located.
Now, for those, and we know you're an experienced dentist, but say, for instance, there's someone who's not as experienced as you are, what is something that will be, I guess, a landmark or an easy way for them to know, hey, that's the hyoid bone? How do they know it's the hyoid bone?
Well, in the panoramic X-ray, it appears on the bottom of the jaw.
Okay.
So it's pretty obvious. And actually, before the exam, I wanted to make sure where the position of the hyoid bone is. So I went online and I just typed hyoid bone and panoramic X-ray.
Good. That's an awesome way to do that.
Yeah, and hyoid bone encephalometric X-ray, and you just get to see where exactly the hyoid bone is.
Ah, and so by having those visuals already, when you see it actually on the test, it kind of just stands out. Okay, perfect. Okay, I got you there. Okay.
So that was one of the questions.
Okay, so let me just make sure, anytime that you say, I call these pearls, I call these magical pearls. So whenever you say a magical pearl, I'm going to do this. That's a ding.
Right.
So one of the magical pearls that you just gave us is the hyoid bone.
Yeah.
Being able to recognize that hyoid bone on the different types of radiographs.
Yeah, and I don't want to say I guarantee, but that came up in lots of the tests.
All right, good. I love that. All right, perfect. All right.
So the second one is sickle cell anemia.
Okay, sickle cell.
And it came up twice on my exam where I was like, really? Are you sure that this is almost the same question as the other one?
Okay.
And they usually ask about sickle cell anemia, how it appears on the x-ray. So it appears as ladder shape appearance.
Ladder shape appearance.
Yeah.
Like climbing a ladder.
Yeah.
Ah.
So either they will give you a case and they will throw that expression in the case and they will tell you what's your diagnosis of the case.
Ah.
Or they will say it's a sickle cell anemia and what are you going to see in the x-ray?
Ah, so pretty much the same question, just kind of reversed.
Yeah, it came up in my exam like that. One question was this and the other one was that.
Okay, so that's another pearl.
Yeah.
So sickle cell anemia, being able to recognize it with the ladder shapes.
Yes.
And then also being able to know if you see the ladder shapes, that is sickle cell anemia.
Yeah, it's like there are certain clues in the x-ray where if you know the word, then you know the disease.
Gotcha. Okay.
One of them is sickle cell anemia, and like the other one is like osteosarcoma.
Ah, okay. And then for those who are out there, just with sickle cell anemia, just a couple of things I also want you to know is that with sickle cell anemia, what you do is you have an abnormal hemoglobin, which is called hemoglobin S. Normal hemoglobin in adults is called hemoglobin A. That's a normal hemoglobin. Also with sickle cell, because of the sickled cell, the cell is not able to carry oxygen like it should. So if it's not able to carry oxygen to the tissues, then you're going to have basically an anemia. So if you don't have enough oxygen to the liver, you can have jaundice because of the liver not functioning correctly. If you don't have enough oxygen to the bones, you can have bone pain related to that. So those are just some of the background things also with sickle cell anemia. Okay. Yeah. All right. What else you got?
One of the other questions that came up on my exam about x-ray was what is the technique used? It was a straightforward question. What is the technique used to detect location of roots on an x-ray?
Location of roots?
Yeah.
Okay.
So how would you detect the location of roots on an x-ray?
Okay.
So it was, we know it like since second year in school, in dental school.
Uh-huh.
So it's called same lingual, opposite buccal.
Same lingual, opposite buccal.
Yeah. And we call it slope.
S-L-O-B.
Yeah.
Slob.
Yeah.
Okay, I got you.
So it's pretty easy.
Same lingual, opposite buccal. Okay.
But then they played with it as well. So they said like same buccal, opposite lingual.
Oh.
So they played with the four
different things.
Yeah. And it's we know it.
So can you repeat that question again?
So what is the technique used to detect location of roots on an x-ray?
Gotcha. And the answer is
same lingual, opposite buccal.
And the mnemonic is slob. S-L-O-B.
It's pretty easy and straightforward, but sometimes when you see other options that looks the same, you feel like, oh, I'm not really sure.
Exactly. So that's another pearl.
Yeah.
I love it. So you've given us 3 really good pearls for radiographs. The first pearl that you talked to us about radiographs was what?
Hyoid bone.
The hyoid bone and being able to recognize that.
On different kinds of x-rays.
Good. The second radiograph, you talked to us about sickle cell anemia.
Sickle cell anemia, yeah.
And we needed to look out for what?
The ladder shape appearance.
Good. And then the final thing that you gave us regarding radiographs was?
The location of roots on an x-ray you detected by same lingual, opposite buccal.
Slob. S-L-O-B.
Yeah.
Well, Dr. Marion, thank you once again for coming down to the MDI Prep Show, sharing with us those wonderful pearls for the INBDE exam. And just like we said before, that anytime that you want a full comprehensive course, visit us at www.mdiprep.online. Look at the INBDE section. We always have classes starting. So remember, no matter how tough it gets, remember this, you got it.